We wish to clarify that KEMSA did not use UHC funds to settle liabilities that arose from the procurement of COVID-19 related health products and technologies, as reported in Section 3.2.12 of the Special Audit Report.
After a one-week break, the Kenya Medical Supplies Authority officers once again appeared before the National Assembly's Committee on Public Accounts for scrutiny, following an Auditor General's report that money for universal healthcare had been used to procure PPEs in COVID-19 containment measures. But things were not easy for the officers on the hot seats, led by the acting CEO Edward Njoroge, especially after he claimed not to have used any coins set for the universal healthcare program for other purposes.
We are not very sure that what you are saying is true, in the sense that it's not clearly indicated here.
The audit report is very specific, that UHC fund was used for COVID activities. So the question is very specific. Give us a specific answer.
The committee members at this point probing further as the CEO found himself in a fix following contrary sentiments.
If I'm to go back one step.
No, I think I don't need much explanation. Did you confirm to this committee that COVID-19 funds, UHC funds have been utilized for COVID-19 purpose?
I believe the correct statement was UHC budgetary space that we had created for UHC.
So in all fairness, before you think that you can always change your word and that you can go around it and that you can play with this committee, we are not interested in punishing you.
In the course of our work, we came across a letter written by the chairman of the board. The chairman of the board himself sent it to the Ministry, to the CS, Ministry of Health, indicating that we utilized UHC budgets. That is in their own letter, signed by the chairman. And then now that one cleared our assertion that now this is no longer doubtful if the top management are indicated that they used the UHC budgets.
At the same time, the Director of Finance and Strategy, Weganjo Karanja, alongside the procurement officer, were put on the hot seat to explain how and why they allowed the alleged misappropriation of funds.
You are the one who literally opens that gate for that money to go out. Meaning that you must be satisfied that certain things must have been done. If they are not done, you say, I'm not going to sign that check. We are asking you, why did you accept to sign those checks when certain things which must have been done were not done?
I am an accountant by profession. An accountant look at the documents. The documents which were submitted to me were all valid. There is no payment which was allowed to go through. That I need to correct.
After CEO signed them, they were brought down to procurement office from where they were being collected.
And even as the investigations continue, KEMSA officials are expected to further make documentation in response to the audit report.
Even if you have expressed yourself in the audit query or not, but witnesses have brought some documents, okay? So for fairness, it would be necessary to have a professional opinion, that is you, okay, before we can express our considered opinion.
Nixon Kisaka, K24 TV.